Polycystic ovary syndrome, or PCOS, is a hormonal imbalance that occurs in about 10 to 15% of women.
Health reporter Haley Hernandez is here with the warning of why women need to treat this as best that they can. Good morning.
So PCOS can increase your risk of other health conditions, and while many people already know that there is no cure, it is best to do whatever you can to treat the condition in order to lower your risk of complications. Most women with PCOS, like Megan Saya, are diagnosed in their 20s and 30s.
I was tired all the time. Depression was one of the main symptoms, gaining weight.
Symptoms of PCOS include depression and weight gain, like Megan felt, unwanted hair growth, thinning hair on the head, acne, and fatigue. Oftentimes, women with kids are told these symptoms are normal, but Megan knew they were not normal for her.
And I was like, okay, well, everybody says your body's never the same after having a baby. So until my son became 3, I was like, these symptoms have been lingering way too long, and that's what kind of caught my attention of needing to take care of it.
If you have PCOS, your reproductive hormones become imbalanced, causing irregular or nearly non-existent menstrual cycles, and that can lead to infertility or unwanted weight gain. But there's a bigger underlying threat.
So let's say someone, example, does not have a period for 6 months. That lining is not shedding, right? So that patient is not shedding their lining monthly or as they should. And when a lining of a uterus thickens, you can have abnormal cells grow, and you can actually end up with endometrial cancer. And these are patients who are long-term untreated PCOS. That is a real concern for those patients. Endometrial cancer, and then diabetes because of the insulin resistance, the long-term insulin resistance, and then hypertension, obesity.
Dr. Megan Pallister with Kelsey-Seybold says testing for PCOS can be as simple as a blood test or an ultrasound. Once confirmed, treatments include lifestyle changes. Some suggest the Mediterranean diet. Sometimes insulin-resistant medications improve symptoms, and medications to block androgen hormones may help acne or hair growth.
So you don't actually have to be on birth control. You can be on progesterone, what we call cyclically, so it's only 10 days out of the month, and it's not typically birth control. It's not going to prevent pregnancy.
And now Megan wants other women to know this.
With the help of kind of taking care of your body, like walking exercises here and there, just kind of living a healthy life is going to help you through this and kind of help reduce those symptoms tremendously.
Now, small cysts might be visible on your ovaries in an ultrasound. Dr. Pallister says that the cysts are not dangerous. They're not painful. They just give a clear indication that that's what's going on. And like she said, if it goes untreated for long, then you increase your risk of endometrial cancer. So that's the real threat here, that, you know, there is no cure. There is no like medication that's going to make everybody's go away, but you still have to treat it. You still have to treat your own individual symptoms so that you don't run the risk of endometrial cancer or diabetes, hypertension. I've got a list of all of the risks on our website, click2houston.com.
All right, Haley, thank you for that.
Thanks, guys.
All right, you'll